Ted Cruz and other Republicans saw fireworks of a different kind during their 4th of July recess when they returned home to backlash against their unpopular plan to replace Obamacare. The New York Times reported that several Republican senators skipped local festivities, hoping to avoid getting an earful from angry constituents who opposed their bill. But those opponents made their voices heard anyway, staging protests in multiple cities across the country. Now, among the few Republicans who had the courage to face the fire was Louisiana Senator Bill Cassidy, who has remained non-committal on the bill, but who got a very clear message from his constituents.
But I'll tell you what's rude, kicking 22 million people off their health care in this country who you cannot afford it. To step on their necks by kicking them off their health care at this point, that's cruel, sir. I think what you need to do as a Louisianian is go back to Washington, D.C. and stand up for the people who are here and saying we need our health care.
Senators return to Washington this week, and while it's looking unlikely that Republicans will have enough votes to repeal Obamacare yet, they're not giving up. The Washington Post reports that Mitch McConnell, Trump, and the vice president are planning a last-ditch, high-pressure campaign to persuade individual senators to support the Senate bill. Joining me now, our national spokesperson for MoveOn.org, Karine Jean-Pierre, and conservative commentator Kirsten Haglund. Thank you both very much for being here.
Thanks, Jonathan.
Kirsten, let me start with you. And, Axios found that the Senate bill, the one that Senator Mitch McConnell is trying to get through, is the least popular major legislation of the last 30 years. And, we've seen the polls, we see the protests. Why on earth is the Senate, is the White House, are Republicans pushing so hard to repeal Obamacare and replace it with Trump care?
Because it's what they promised for the past 7 years. And I think that Mitch McConnell and other Republican leadership realize that if they don't do something now, then they're going to have to face even angrier constituents, and that is the Republican base, who this has been such an issue for the last 8 years. The problem is that they've gone from being against something to now they have to govern and figure out how to craft a policy that really serves people and really, tackles some of these very, very major issues for people that they're facing with health care. They have not been able to do that. They've not been able to meet that challenge, to govern well, to bring the governing coalition together, and to also understand that the American electorate has changed since 2009 when the Affordable Care Act was passed, right? Before, people wanted things like freedom of choice, but now they have had a benefit for 8 years. And you can tell that the GOP leadership and the American people are not even on the same page, because success in a health care policy to the American people looks like coverage, and to GOP leadership, it still looks like this freedom of choice. Things have changed, and they need to really represent their constituencies.
Karine, what's really surprising is, as Kirsten points out, since 2009, Republicans have been banging away against Obamacare, saying how horrible it is, how they're going to repeal it and replace it, they're going to put in something better. And now here you have the Senate Majority Leader Mitch McConnell, who's trying to cobble together 50 votes to pass whatever bill that they're going to pass. Let's take a listen to what the Senate Majority Leader had to say on Thursday when he was at home in Kentucky.
I'm in the position of the guy with the Rubik's Cube, trying to twist the dial in such a way to get to at least 50 members of my conference who can agree to a version of repealing and replacing it. Where we end up if Republicans are not able to agree among themselves is the crisis will still be there, and we'll have to see what the way forward is at that point.
Karine, isn't the way forward at that point working with Democrats?
Yeah, that's exactly right. What they're learning is, what Mitch McConnell and Republicans are learning is that rhetoric is not governing. They had 7 years to work with Democrats. They didn't do it. They had the first 6 months of this year to work with Democrats. They didn't do it. And now the problem that we're seeing is that this Trump care, which is the GOP health care bill, is not a health care bill because it's kicking off 20+ millions of people out of coverage. And so that is the issue at hand here. here. And so they can't really do this anymore without bringing the Democrats in and fixing Obamacare. You cannot repeal Obamacare because what they're putting forth is not actually replacing anything. Not when you're stripping away protections for people with pre-existing conditions. Not when you're making it so unaffordable that the only people that could afford it are the wealthy.
You know, Kirsten, the Commonwealth Fund did an economic impact of the Senate health bill by 2026. And take a look at some of these numbers. 1.45 million jobs would be lost, $162 billion in gross state product would be lost, $265 billion in state business output. Between those horrible numbers and the protests happening around the country, if you were talking to the Republican leadership and you had a chance to sit down with Senate Majority Leader Mitch McConnell facing all of this stuff, what would you advise him to do?
Stop. Stop and listen to the people. Stop and listen to your people. That's something that actually senators from rural states, in particular Kansas, Maine, North Dakota, went home and they realized this week when they talked to people, they realized that their constituents who live out in rural areas where the hospital is the #1 employer in town, you saw the economic impact that, you know, the repeal and this replacement bill would have. They heard directly from those people, and now they're stepping back. And these are some, you know, usually very solid Republican votes. So Mitch McConnell's got to stop and listen to these folks, because a lot of them were very angry at Obamacare for the past 7 years. But I think we've got to step back and realize, especially, you know, as conservatives and as the GOP have to realize that a lot of people were so upset with Obamacare because of what it symbolized, not necessarily its impact on their lives. That's why they might fight against Obamacare, but at town halls they say, don't take away my insurance. So what Republicans have got to do is make sure that they're passing something that will actually work for people, not just to pass something. And that in the long term is going to help them. Even if they lose some seats in 2018, it's also going to show millennials and younger voters that they really, really need to appeal to as well, that they're not just a party of cutting taxes for the wealthy and only care about a very certain small group of people.
Right. And Kirsten, I mean, you raised very good points and a very rational plan for the Senate Majority Leader, if only he would listen. And given what you just said, and given the anger that's out there, pose this question to both of you. Karine, go first. I want you to go first. Is it possible, do you think, in this environment, leave aside Trump care, let's say that effort dies and Mitch McConnell has to work with Democrats to get something out of the Senate, is it possible to work with Obamacare and fix the things that everyone knows are broken in that health care plan?
Well, just listening to Mitch McConnell on Thursday, it seems like we're getting there to that possibility. And Democrats have said they want to come to the table and fix Obamacare. So we have to see. I think we're getting to a place now where especially moderate Republicans are seeing that if they touch Trump care, if they come near it, it's incredibly toxic and they'll be firing themselves out of office. So now they're put in a situation where, look, your constituents are saying, they're giving you an earful. They're saying, don't take away our health care. So now what are you going to do? 2018 is right around the corner. Democrats are saying, we want to fix things in Obamacare. There are things that need to be tweaked. So now they have to come to the table, and I think we're getting a step closer to that.
Kirsten?
Yeah. You know, I think for the healthcare markets to work and stay viable, because right now the truth is that in many states they're close to collapsing, health insurance companies as well as hospitals, they need consistency, right? So at least if Republicans and Democrats get to a place where they have to work together on things, those organizations, those businesses, and that economic impact will be lessened because all of these organizations and these players, these stakeholders will have some economic consistency. And in 2018, a person we all know said, it's the economy, stupid, right? People are going to want to know that their jobs are there, that their communities are safe, that they have their health care, and that's going to speak more to them than this current debate, which is just in shambles. It's about the economy, and working together is going to provide more stability and consistency that people really need.
Kirsten Haglund, thank you very much. Karine Jean-Pierre, you're coming back.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.